Hello, everyone. I'm Kate Lipper-Garabedian, the state representative for the 32nd Middlesex District, which is Melrose, Wakefield, and Malden. And since the fall, I've been pleased to put together a series of virtual community conversations about issues that matter not only to my district, but also really Commonwealth-wide. And so this will be our third in the series, and I'm just very grateful to my esteemed guests for joining us this evening to share their thoughts about a critical issue of great importance to many individuals and their families, which is mental health during the COVID-19 pandemic. And I'm thinking not only over the last 13 months as we've grappled with this, but also as we near perhaps the beginning of a recovery phase, which I expect will have a very long tail. And I'm really excited to hear from the panelists tonight about their thoughts, both in terms of the challenges we're facing today and the resources that exist, as well as what we can anticipate for ourselves and each other in the months to come. So I'm going to start by providing a quick introduction of the panelists, and then each of them will have plenty of time to share more about who they are and the work that they're doing in a sort of two-pronged conversation. First, about mental health during the pandemic, the challenges we've been seeing, the resources that currently exist, and then what we might think about mental health during the recovery phase. And for those of you who are joining us in person tonight, as well as many of you who will be watching this as a taped conversation, we all certainly hope that you and your families are doing well, and you should be sure to reach out to me in my office if there are things that we can help you with. At the end of this presentation, we'll provide some contact information, both for me and for the different organizations represented tonight. So again, I'm Kate Lipper-Garabedian, and I'm very thrilled to recognize the four esteemed guests that we have here who are clinicians in the mental health field and will be able to share their thoughts and their expertise with us tonight. So we're going to hear first from Christina Lorenzo. She's an outreach crisis counselor at MassSupport. This is a really important statewide organization. I was pleased just about a month ago to participate in an event that MassSupport sponsored to really highlight how we're dealing with the pandemic in terms of our own personal mental health and well-being, and what sort of challenges we're seeing and ways in which our communities and individuals have been resilient during this time. We'll next hear from Sarah Rigney and Dr. Courtney Tucker, both with BRYT, the Bridge for Resilient Youth in Transition. I'm really eager to hear from them as the mother of two young boys, as well as someone who's very familiar with BRYT. In my previous role as the Chief Legal Counsel at the Executive Office of Education, I had a seat on the statewide Safe and Supportive Schools Commission, and BRYT was a frequent contributor and attendee at those meetings, talking about the importance of our social and emotional well-being of our students. And certainly during this time, our kids have had to really curtail much of what childhood is all about. And so BRYT will be able to talk to us some about what they're seeing among our youth and thoughts for our families in terms of how to support them during this time. And then for a more local perspective, we'll turn to Jennifer Waczkowki, who is the clinical coordinator for the Wakefield Police Department and Eliot Community Human Services. As a state representative working with Wakefield, I've been so impressed by the holistic approach that the Wakefield Police Department has taken, including with Jennifer as a leader, in terms of thinking about how mental health intersects with our criminal justice system. And I'm very interested to talk with her about what she's seeing in those last 13 months here on the ground. So with that, let's turn to thinking a little bit about the challenges during the pandemic in the last 13 months. So of course, this pandemic has absolutely taken a toll on the mental health of so many people across the Commonwealth. And it's safe to say that in one way or another, we've probably all been impacted mentally by it. I will note at the outset that both the public health crisis and the economic impact of the pandemic occurring at the same time that our nation again is wrestling with this history of racial struggle and oppression has not been borne equally. And we certainly see disproportionate impact cutting across race and ethnicity, across age, across gender. And that's something maybe we can unpack a little bit in our conversation. But certainly since the start of COVID-19, we've seen many Americans indicating and confirming that they're dealing with a lot of stress and anxiety and depression. And so, you know, as I was looking through my notes and thinking about where we see this coming up, you can find headlines every day or data points every day. So here's an example of where people are seeking access to mental health supports and maybe are having trouble attaining them. And you'll see in this figure that mothers were among those who were most unable to reach services in the past year when they needed them. We also see many adults reporting that they're dealing with sleeplessness and anxiety, also with depression. And then in our school age population, a report that was provided to the Department of Elementary and Secondary Education by numerous medical professionals and experts in the Commonwealth noted many of the mental health challenges that our students are facing as they've been unable to participate in most of the general activities that childhood is supposed to entail. We've also seen behaviors enhance perhaps that maybe existed before the pandemic, but now have been exacerbated. Certainly this came up in a conversation that I've had recently with our local Department of Health. And just yesterday, I got an alert on my phone about overdose deaths increasing and surging to their highest level in the last year. So these are some of the challenges that we are identifying, and I'm sure these may, hit home to those watching as well. And what is causing all of this? I mean, there are many different ways in which, our mental health is impacted. So, of course, at the base level, there's been an unprecedented amount of loss of life over the last year. A recent study found that at least 37 children in the United States have lost a parent to COVID-19 so far. And so many of us have experienced the loss of life of a family member, a colleague, someone close to us. And even if maybe it wasn't loss of life, people who have become significantly ill from the disease. We've also had mental health impacts from losses through social distancing. We're a social species, and not to be able to spend time together can certainly impact our mental health. It's caused us to cancel different milestones and social rituals and various events, a sort of disenfranchised grief that we're feeling from the loss of these types of activities. As I mentioned as well, COVID has sort of been a two-pronged pandemic. We've had both the physical health challenges and risks of the disease, as well as tremendous financial fallout from it. So many, families have dealt with unemployment and loss of income, leading to financial instability, concerns about paying bills, maintaining housing, having enough food for your family. These are all things that my office has heard about from members and constituents and neighbors, nearby. And so I'm certain that that's the case across the Commonwealth. And then finally, of course, the pandemic occurred at a time when many of us were already working to address mental health challenges. And that includes, for example, our substance abuse challenges. So it's the case that the pandemic maybe both caused new mental health concerns, but also exacerbated some that existed before. So when we're faced with these challenges, of course, we want to step forward and think about some resources and responses to them. And those can occur at the federal, state, local, and of course, private level. You will find on my website, and I've linked it here, kateforrep.com/COVID-19, a series of resources that my office has put together to try to help constituents and folks who don't even live within the district. And so we have one on personal well-being. I've taken a screenshot there. You'll see it has some of the resources that the state has stood up in terms of hotlines and landing pages to identify supports. There are also resources and programs attuned to specific concerns, whether that's behavioral health, domestic violence resources, sexual assault resources, and substance abuse support. There's also another resource on that page dedicated to perinatal and postpartum health, an issue that's dear to me as somebody who struggled with mental health issues after the birth of my first child. There are also resources you'll find on food, on housing for small businesses, and how to apply for unemployment. So please take a look. Additionally, the Massachusetts Department of Mental Health has created a database of resources. You can find that at mass.gov/coping during COVID, or by calling the 211 hotline to talk to a person. You'll find on that landing page, among many others, there are ways in which to take account for demographic factors such as race, gender, and ethnicity to address specific problems that groups of people may be facing. And there are also resources attuned to children and their parents. In the last year, I've been pleased to also support a number of state laws that have been attuned to the issues of mental health and supporting families during this time. That includes a major healthcare reform bill that we passed to enable more telehealth, because obviously it's harder to access behavioral health and other types of healthcare when there's concern about being out in public. We also created some health parity in terms of insurance payments for behavioral mental health. So those are two resources that are a couple laws that come to mind. So I'm going to pause there. I've talked enough, and I'd love to turn now to our panelists to hear their thoughts about, first, where we've been over the last 13 months, what kind of challenges you've been seeing in terms of the folks that you're serving and interfacing with, and also what are resources that you'd like people to be aware of. And so I'm going to turn now first to Christina Lorenzo with MassSupport, and I'm going to advance the slide for you, and I invite you, oh, excuse me, we've lost, the slides are not in the right order. Let me find the right slide. Here we go. On this slide. All right. So let's start with you, Christina, and thank you again so much for being with me tonight.
All right. Hi, everybody. My name is Christina Lorenzo. I'm an outreach crisis counselor with the program MassSupport. Thank you so much for having us here today. MassSupport was a program that was put into action as a direct result from the COVID-19 pandemic. So we're very happy to be here today. Thank you specifically for sharing that last slide with all the resources on it and the helplines. I would like to say, as a person with lived experience seeking out some of these resources for myself, that spreading awareness about how to reach some of these sources can really contribute to saving lives. You can have the potential to make a huge impact in a life by spreading awareness and letting people know where to find them. So thank you for doing that. I can also speak to whether this is your first time looking at mental health services or you've done it before. It can definitely be a scary process, a little bit overwhelming. It doesn't have to be, but it can be sometimes. And that's why I'm grateful that there's programs like MassSupport in order that can help guide you through what could be a overloading process. So MassSupport is funded by FEMA, and it's managed in partnership between Department of Mental Health and Riverside Trauma Center. Next slide, please. So what is MassSupport? We are a crisis counseling service. And when a lot of people hear the word crisis, they think I have to be in a state of crisis to utilize this service. And MassSupport actually looks at the word crisis in relation to the pandemic. So that is the crisis we're facing. You can use MassSupport for any problems that have come up relating to the pandemic. So whether you're looking for support for some of your children, support regarding re-entry into schools, you lost a job due to COVID and your landlord's trying to evict you, or whether you just need some emotional support, we're really a broad resource there to help everybody in Massachusetts. Everything we do at MassSupport is free, confidential, and anonymous. So if you do call our helpline or come to one of our groups, you won't be asked to provide a name or an address or health insurance number. You can just speak freely no matter who you are in Massachusetts. So like I said, we are managed in partnership with Riverside Trauma Center. So a lot of the groups we do are evidence-based and research-backed with a trauma-informed lens. And the pandemic is kind of a long, prolonged series of traumas. It's not just one event. We don't even have an end date on it yet. So it's good to have that focus when we're going into some of the strategies here. And so some of the key core values at MassSupport is, unfortunately, we don't have the ability to take away the specific trauma that happened. I honestly wish I could, but we can't make that event not happen. We can definitely support you and empower you as you're going through the transitions and the challenges. So our goal is really to give the power back to the individual calling out for help and not to fix any issues that are out of our control. And with that, we really like to focus and promote that recovery from any event is individualized. You know, what works for Jill won't work for Jack. And I've said it when we've done presentations in school, 4 + 4 = 8, but so does 7 + 1 and 2 + 6. There's plenty of different ways to find recovery and wellness during this process. And So sometimes the body will actually shut down a little bit emotionally when we're feeling such a stress response, just in order to get through the day and do what we have to do. So we like to remind individuals of what they've done in the past, that they already come to the table with strengths, and try to remind them what has worked. Are you doing that now? Do we have to alter that and come up with new activities to keep you healthy? But basically remembering that you've used tools in the past and we can help enforce that to get us through the pandemic. And last thing for this slide, we just want to keep in mind as we're going through the pandemic as a whole, that we might be vulnerable, but we're not powerless. So there's many things we can do to affect our outcome here. Next slide, please. Okay, so this is just a general overview of the MassSupport program. Like I said, it was put into action specifically due to COVID-19. So we do have our helpline number right here. They are open 8 a.m. to 8 p.m. Monday through Saturday. I think the number will be later in the slides too if you want to write it down. But like I said, you wouldn't have to provide any information if you call. We have caring, compassionate staff that will just kind of help guide you through the options of resources and how to get in touch with them during COVID. Let's see here. I just wanted to mention that we do have a very variety of people that work with MassSupport. So it goes all the way from doctors, trauma-informed clinicians, therapists, and peer specialists, which have actually sought out services themselves so they can relate to the process and help walk someone through that. So very wide range of people that will be answering this call. We do most of the one-on-one counseling through the 888 number, but also if you're not a person that likes to speak on the phone a lot, we do have an email that you can also email to get that one-on-one service. I'd like to state that everybody that works at MassSupport was trained in psychological first aid and skills for psychiatric recovery. So basically they just help manage stress response after a trauma and how to de-escalate some of the body sensations that may be going on. And besides the one-on-one counseling and the helpline, one of the biggest efforts that we have at MassSupport is our self-care and coping groups. So we've been doing a lot of these in schools, middle schools, colleges, with healthcare workers. You know, we've done grief and loss coping groups related to some of the loss during the pandemic. And I can say firsthand, the therapeutic value of seeing these coping groups go off. A lot of people aren't used to asking for help. So this is the first time they've spoken about mental health, and just giving them a safe and supportive space to let out anything that they've been holding in. It's been really amazing to watch people feel relief through these groups. Next slide, please. So these are just a couple of the topics that we cover when we do some of these coping groups. They're actually very adaptable to whichever population we're serving. So we do switch up the questions for each person, but just as a general topic that we talk about, I want to say safety, predictability, and control is huge, especially for moving forward in this and where we've already been for this past year. I feel like the pandemic has kind of taken a sense of control and safety away from people, or at least that's how we feel. And so there's many techniques we can put into place, like creating a schedule and, you know, staying away from all different types of media that might put you into a panic, maybe only looking right at the CDC website, and basically eliminating any sources of unnecessary toxic stress. So it's very individualized. We can help people step by step find out what works for them, not a general plan that will work for everybody. It's very individualized. And like I said, the body can shut down a lot when it's having stress reactions. So at least to understand a little bit what's going on in your body, to know that it might be, you know, okay, I'm having a response to stress in the pandemic. I'm not just, you know, freaking out over here, because people don't really know if they've never been through, none of us have been through this before. So we're taking it step by step, trying to learn the reactions we're having in the body and why. Sleep has a lot to do with that. So it can definitely affect how you function in the day, your mood, your overall well-being. So that's a big topic we've been working with people on, is sleep and how to have healthy sleep hygiene. Resilience and skill building, I mentioned that a while ago, but just saying SMART goals, making them measurable and attainable. So I feel like everybody knows, or everybody, I know if I worked out every day, I'd feel a lot healthier, but getting myself to actually work out, it's kind of like I wasn't doing anything at first. So I tried a SMART goal with myself, and I said I would like to work out an hour every day, but that wasn't realistic. It wasn't attainable. So I set a smaller one for myself of 10 minutes twice a week. And when I hit that, just to get the momentum going of something we know we should be doing, but it's just hard to get started, you just feel a great sense of pride, and it just keeps building on that. So there's many ways we can work with people to get their goals going during the pandemic, for sure. And basically just trying to give people a sense of joy. We want to support them in any way possible and make them feel as healthy and happy they can at the end of this pandemic. Next slide, please. So as I said earlier, you won't be asked to provide any identifying information. This is just a slide regarding some of the people we've worked with during the COVID-19 pandemic, schools, students, COVID survivors. It's just moving forward from this day, we would be probably having a more focus on healthcare workers and school reentry, because those are going to be some of the big topics coming up. But definitely anybody in Mass, if you fall under one of these categories, or friends or family that could use general services related to mental health, resources, we can definitely help support you in that. Next slide, please. Okay, and this is where they have the email address if you'd like to email instead of call us. They also have people available to speak in multiple different languages down at the bottom there. So that's a really great resource. We want everybody to feel like they have someone to reach out to, no matter what language you speak, no matter what age you are. So definitely write down the email, the phone number if you'd like. Next slide, please. All right, and just on this last slide here, I just wanted to mention one way to keep in touch with us moving forward. So we have all the computerized ways to keep up with us: Twitter, Facebook, Instagram. YouTube does put out facts, weekly COVID-related facts about, numbers related to COVID. So if you check out MassSupport on YouTube, you can stay updated with that. And if there's any way that I could personally help or reach out to anybody, my email address is here. I'm very grateful to be a part of this, and just supporting people, helping people here. Thank you.
Thank you so much, Christina, for that helpful overview. I was really impressed with all of the different resources and ways in which MassSupport has quickly and nimbly stood up to support people across the Commonwealth. And I can tell how passionate you are about your mission personally, and I'm confident that your colleagues feel the same way. So, on that, and you mentioned actually school reentry going to be, a big topic and a big focus moving forward. That's a nice segue to talk a little bit more about our youth and our children and students with Courtney and Sarah from BRYT. So I'm pleased to have you both join us now to talk a little bit about the work that you've been doing and your thoughts about how we've been managing these last 13 months, and what are some resources that you'd like families to be aware of moving forward.
Yeah, thank you so much, Kate. Hi, everyone. My name is Sarah Rigney. I'm a licensed social worker here in Massachusetts. And really quickly, so BRYT is a program that is run out of the Brookline Center for Community Mental Health. And we partner with schools to implement a model geared toward providing intensive support to students who have encountered either a major mental or medical health event that's interrupted their learning. So in our model, we really pride ourselves on working very closely with families, students, teachers, and other providers to wrap around a student, either post-inpatient hospitalization, medical event, or with students who struggle with more moderate but chronic mental health issues that really impact their ability to show up consistently to school. So our goal is to really provide clinical, academic, wraparound, and family support to those students so they can successfully re-enter school and get back to classes. And so, how to encapsulate like the last 13 months is really challenging. But I guess one of the things that we've been saying for a while now at BRYT is that we're really characterizing the last year as a slow moving trauma, right? So remembering that, you know, stress is not inherently bad in and of itself, but stress that is extreme, prolonged, and has no apparent ending really tends to sensitize us and make us feel really vulnerable. And that is when we struggle to maintain our coping skills, we struggle to implement structure for ourselves. You know, that kind of pressure, that kind of stress really takes up a lot of space, both in our bodies and our minds. And that's why we started to see, you know, or not started, we have seen such an increase in anxiety and depression rates, really across the population. And our kids aren't immune to this. And so, in fact, some of what I thought I'd speak to more so is some of the stuff that we're actually seeing more immediately in the return to school in terms of symptoms that kids are having. And so, you know, I do want to note that some kids are returning and they're super excited to be back in school. The structure feels really good to them. And also, even those kids are feeling incredibly fatigued. We're seeing behavioral regression, which you know, it's going to look different across your age range, right? But in our younger kids, that could be more tantrums. It could be difficulty sleeping. It could be clinginess. It could be some separation anxiety. And in your older kids, it may be, again, a lot of fatigue, irritability, difficulty focusing or concentrating, behaviors you might characterize as younger than what you've seen in your child recently. And yet all of that is actually really normal, right? So it's nothing to be concerned about so much as it's something to know and expect is going to happen as these next few weeks unfold, because we're going through another change. And part of how we manage changes, you know, we kind of go back to old coping strategies. Other things that are of greater concern, you know, speaking to what Christina said, we're seeing a lot of sleep hygiene issues. Kids have gotten totally off of any kind of normal schedule, a lot of kids. And part of that has been a response to, you know, when you can't go outside your house and hang out with your friends, which is like the big, you know, developmentally typical, normal thing to do as a kid. You still want your privacy. You still want some time to hang out with your friends. And so we find that that's happening a lot in the evenings and late at night and in the early hours with kids. And so, so their sleep schedules are off, their sleep hygiene is off, and it's actually leading to some significant mood dysregulation that's of, you know, emergency room hospitalization level dysregulation. I'm sure, you know, a lot of you would also recognize that there's been a real increase in anxiety symptoms. And yeah, this is definitely, you know, to be expected with kids who have a history of anxiety, especially any related to school and the idea of returning to school after so long. But we're actually also seeing a lot of anxiety from high-performing students who are used to getting A's and, you know, having school be relatively straightforward. You know, the truth is across this year, starting back in the, you know, certainly starting in the spring, but most definitely even in the first quarter of school this year, schools were reporting numbers, you know, kids getting F's or failing classes that were in percentages they'd never seen before. And, you know, some of this is from the amount of change. This is some from the remote learning. Some of it's from the fact that, you know, our kids don't actually have as good executive functioning skills as we think that they do. So doing asynchronous work proved to be a real battle for a lot of kids in terms of time management and organizing and prioritizing, which are fairly, you know, adult skills actually. So the strain and the stress of really having their worlds turned upside down has had a significant impact on kids. The return to school is, I think, maybe more of a beginning than an ending in terms of mental health issues that we're likely to see. And so that's part of what we ought to expect, is that this is just the beginning. And I want to speak to this idea of loss of learning also before I invite Courtney to jump in. I know there's been a lot of concern about this, and I guess part of what I would say to that, and I would have people reference a great article that came out in Ed Week probably about 7 or 8 weeks ago, written by a Boston public school teacher who did a restorative circle with her students and asked them their thoughts on loss of learning. And I think what was really impactful is what the students talked about is all other kinds of loss that they experience, including loss of loved ones, loss of their self and identity, loss of agency and any sense of control over the world, and the ways in which that's impacted their self-perception and self-esteem, and the immense amount of grief that has come along with that. And so, as we return, I guess the last thing I'll say before I turn things over to Courtney is that, we are also really focused on resilience building, and how we're defining that is, we really need to reconnect. As kids move back into schools, this is about reconstituting communities through connection, authentic connection at that, where we find meaning in our relationships with one another, where we find predictability, where we practice moderation, right? Where it's not a return to normal. It's not like, hey, let's catch up. It's more about like, how do we connect in a meaningful way and process some of the experience of the last 13 months. And where we give kids back a little bit of their agency, some of their decision-making capacity, so that they begin to find themselves again. Courtney?
I just want to add a couple of points to what Sarah said. And one of the things that's really important to remember, as she highlighted, like, what do we need to do? And she said, how do we reconstitute? Reconstitute is like puzzle pieces. How do we come together again, right? Some of the pieces are further away from apart from each other. Some are close together. Some maintain connection, right? But all within the school community, we've been shaken, right? The whole community has been shaken. One of the things that helped when we were constituted together before was this idea that we all, let's say, it's something called allostatic load. And that's just how we handle stress. How do we carry it? How do we handle it? What's happening, right? And if you think about it and think about that load as a bucket, right now, some people's bucket were all the way full, not full, and now they're really full, right? And when your body is full, it leads to burnout, right? After that, you're like burnt out. You're tired. You don't know why you're tired. You're like, wait, my bucket is really full. But the key thing is to remember, burnout doesn't say you don't care. Burnout says you're caring ineffectively, right? And so the question is, how do we reshift that we begin to care for ourselves and our community in a way that doesn't lead to ineffective caring, right? Like the pushing through. And so ineffective caring is when we begin to think about when we were interacting with each other, when we were connecting, when I was able to be in the office with Sarah, I could walk by and she would say, Courtney, you got this. You're doing good. You're moving, like today is going. And I'm like, oh, I'm tired. We've been here all day, right? But we're able to connect in that way. And so what's happening with kids is that they haven't had anybody around them to say, hey, you're okay. Nothing has normalized that experience because they've been in isolation. So how do we even get them to start talking about and having conversations about how they're feeling and what it's meant to be a kid during this time so they don't feel alone, right? So that's one of the most important things. The other things kids are saying they're not getting from the adults in their life is something as simple as validation. And validation doesn't say, I agree with what you're doing, but validation says your feelings have meaning. Your behaviors come from a place that you're trying to express yourself and you can't. And so kids are saying, 90% of kids say the adults aren't validating me right now. They just want me to do, but nobody's validating my being, right? And so for kids, that's really important. The other thing I would add is that we really take a trauma-informed approach in our work. And if you think about it from the bottom up, the first thing you have to do is you have to regulate, and then you can relate. So that's that connection, authentic relationships. And then you can reason and reflect. But I think a lot of times we're trying to bring them in and say, you know what? We want you to reason and reflect. We want you to learn and this. And people are dysregulated in their bodies. I can't sit still. I'm tired. Like Sarah was saying, I'm sleepy. I'm having brain fog. I don't know how many, and even the adults are having this, right? Like you walk to the door and you're like, I don't even know what I was about to do. And so kids are experiencing, everybody's executive functioning is low. And so how do we begin to say, you know what, I'm going to help you regulate. We're going to bring in some mindfulness activities. We're going to bring in a space where I just help you be present in the moment before I'm trying to get you to reason and relate. And that's really important. The other thing we have to think about in this environment with our kids is Dr. Bruce Perry says this: a dysregulated adult is going to really struggle to regulate a dysregulated kid. Kids attune themselves to the adults in the room. So how are we taking care of the adults that the kids are going to interact with is as important when we think about how are we taking care of the kids. And for parents out here, I want to tell you, the way you breathe, your kid will breathe. If you're calm, your kid will regulate themselves to you, how you respond to them. So how do we create an environment that fosters regulation? How do we model for them self-compassion? Something as simple as saying, you know what, you are doing the best you can. How can we start adding more affirmations into the day? I am good enough, or even telling yourself, you know what, my best today can look different from my best yesterday. But I'm still present. How can we find spaces where people are already dealing with shame and guilt about not performing in ways that they performed in the past? But how can we not let them hold on to that and give them spaces of hope? How can we begin to pull out what is good instead of saying, well, you need to do better, right? Or you're overreacting. Can we get rid of over? Can we just stop using over and just acknowledge how they're feeling? And so I would say those are the things that we really need to think about in this time. And we need to model boundaries. All of us need to think about boundaries. What are the boundaries we're having with our space, with each other? And in those boundaries, can we take a moment and just really focus on being present? Can we say, you know what, we're going to have a no technology moment, everybody. And just for 30 minutes, we're just present. Do a puzzle. Fostering creativity can cause your positive effect to go up. Because if you're doing something creative, you have to have hope in what you're creating. So if you can get kids to lean into that creativity, you'll increase the positive effect that they're having. You'll increase their mood. You'll decrease the anxiety. And so those are just some things that I wanted to share with you all that we're seeing in the work that we're doing. And just want to encourage everyone, let's show up. Because some people are having, their buckets are really full. So the other thing you can do is think about, how can I just offer support to somebody without them asking for it? Because right now, a lot of people are struggling to ask for it, but something as simple as saying, here's a cookie, or something as simple as saying, you know what, I'm going to give you a card that just expresses how well you're doing, or I'm going to treat you to dinner. For kids, just saying, come on, let's go for a walk. Let's just get out of here. Let me take you to get some ice cream. Even when it's not asked for, is a way that you can foster care and show concern and help someone feel seen, heard, and valued in the midst of what feels like ongoing trauma, a collective trauma that we're experiencing.
Thank you both so much for those thoughts. I'm glad that we are recording this, because as a mother who doesn't always feel like she's doing her best, I think I'll go back and rewatch some of these tips that you've shared, and I think they'll be generally applicable and helpful for many people. I do think, and I think I shared this with you all in a conversation we had earlier this week, that when I look at my family and recognize, of course, as we talked about earlier, the ways in which this pandemic has not impacted everybody in the same way, and that my family has been incredibly fortunate on many measures throughout this time. I look at all four of us, and I think the one of us who has struggled the most is my school-aged child, because for him, life has changed most dramatically. As an adult in my profession, I'm able to do a lot of the things that I did before, just through a different venue like this. And for my very young one, I don't know that he'll even remember this time, but for my second grader, life is just so different from what it would otherwise have been. And there is a huge amount of loss and grief in that, even if he's not processing it entirely. It's very evident to me. And so I'm grateful for you all both talking about that, and also sort of leading us to be thinking about ways in which we'll continue to support our kids in this very long recovery phase, as you mentioned. So I'd like to turn now to Jennifer and hear a little bit about what you've been seeing in the community in Wakefield, which I think, would be broadly applicable to other communities across the Commonwealth. you're facing, our neighbors who are at acute moments that are highly stressed and involving, significant mental health issues. And so, I like sort of reflecting what you've heard so far, but also then just sharing your own impressions of what this last year has meant. And again, thank you for being here and for everything you're doing to support people during this time.
No worries. Thank you so much. And Courtney, I wanted to say, I like your little tip about doing unexpected sort of things for people. I actually the other day just left my friend at my other job a little like card that had a unicorn on it because we were discussing unicorns, and I just was like, hey, like just thinking about you, and just threw up a card, or making some cookies for somebody is just kind of like a small little way I think you can be there for people, which I think we sometimes don't get enough of. So hi, my name is Jennifer. I'm the clinician. I work with Wakefield Police Department. I'm technically a clinician that works with Eliot Community Human Services, but I'm stationed right out of the police department in Wakefield, have an office there, and I'm there what feels like 24/7, but I'm there Monday through Friday, typically 10 to 6, but my hours kind of have varied a little bit. My role is a little different and unique, as it's not a typical kind of mental health sort of what you think about when you envision mental health. You think of like one-on-one counseling, or maybe a school counselor where you're seeing people in a school setting. Mine is kind of more boots on the ground, immediate crisis, or lower level crises that happen. So it's kind of a little bit different. So I thought I would just take a few seconds to kind of discuss like my role and kind of like what we do at the police station, so you get a better understanding of that, and then kind of go into a little bit of what I've kind of noticed since COVID has happened. So at our department, so again, I'm the clinician there at the department, and I'm available for the officers anytime there's any sort of call for service that has any mental health or substance abuse component that's believed to be a contributing factor in the reason for the call. I'm available to go out in the moment and get in the cruiser with the officers and respond in the community immediately. Or I have officers who refer things to me after an incident happens and ask me to call or go in person and follow up with individuals. This typically happens, 3:32 a.m. when I'm no longer on shift and I'm hopefully sleeping in my bed. But I will follow up with people the next day. I also do get calls from community treatment providers or people that I've worked with in the past who've given my number to other people, or they are struggling and they've worked with me before and they're looking for more support. So my role has a very broad sort of thing. Could be somebody's, as small as somebody, injured themselves and they're having a tough time, to something much bigger that's happening in the community. Our department in general is actually, I think Kate mentioned that there's we're kind of like unique in that we do a lot for the community. We have a lot of, I think we are ahead of the curve. So we have myself, who's there full time. We have a family service officer, Officer Rando, who helps people, families, domestic situations, elders, substance abuse. We also have, we're lucky to have somebody from Respond. So we have a domestic violence advocate who can follow up with some of the domestic calls for people who are interested. And we also have a recovery coach through Eliot, who's with us part-time and who's able to follow up with interested people who are seeking more support with their substance use recovery. So we have kind of like a whole plethora of services and supports in our department. So sometimes I think people are like, why would people call the police? But we're actually like a pretty self-contained unit and have immediate access to resources. And one thing I've noticed is that we're there, and we're there 24/7. So we can provide immediate response and immediate assistance to people who are struggling. So it's kind of a little bit about our station and kind of what we do in the community. In my role in general, I've sort of noticed that there has been like an increased call volume for mental health, substance abuse, and domestic calls since the pandemic started. Initially, I think we had a little bit of a lull, and for myself personally, it wasn't necessarily a lull. I would get a lot of people who I've had experiences with in the past who are just calling and seeking a little bit more support. And I think some of that was due to the social isolation, and they just needed kind of even just a phone call with somebody who they were familiar with. So my calls actually went up. Well, some of the officers' calls went down initially when the pandemic first started, but I got a lot of extra support calls from people seeking additional support. Some of the things that I've noticed, we've had changes in service delivery. So a lot of the people in our community went from seeing people in person or being able to attend things in person, and then that changed to more phone or virtual contact than in person, and that's definitely had a huge impact on some people. We've had disruptions in routine. So people, can't go to, meetings that they used to go to, or groups, or in person with their therapist or psychiatrist, or if we have a clubhouse in town, people can't go to the clubhouse. So that's been a disruption. We've also had routines switch for people. So if they're seeing, providers in the community a couple times a week, and now they're going to once a week, that's a big change for people. And then there's just in general been a lot of social isolation, which is, I think, difficult for everybody, but especially people who already feel like they have a level of social isolation prior to kind of going into this. So it's definitely been extremely difficult for a lot of people. I was actually personally myself, I was grateful to actually have to be one of those people that went into work, because it gave me that social interaction that some other people didn't have by working from home. Some of the things that I've noticed and seen, and some stuff that people I work with have noticed, one of the things our recovery coach had actually mentioned to me is that there are some people that have had long-term sobriety who've actually relapsed during the pandemic. People who, because some of their support systems that have been in place, going to meetings, being able to see people in person and struggle, they've been able to isolate and then not reach out to the people that they need. So that's been kind of one of the things we've been seeing. And Representative, you mentioned that there's overdoses are increasing, and this is some of the things that are happening. So somebody who's been in long-term recovery and hasn't used in a long time, if they're using again, they're at higher risk for overdosing. I would say pretty much about halfway through the pandemic, we started seeing more high priority and high acuity calls, not just kind of these, not some like smaller crises, but much bigger crises that have happened. I think that some of that's sort of like a snowball effect. In the sense they have smaller problems that keep on getting bigger and bigger and bigger. These calls have kind of led to situations that were more time consuming, more challenging, and also very distressing on everybody involved. When I say everybody, I mean the person, the family, myself, the officers, everybody who's responding, because they are such higher level situations. So that's definitely been very difficult. I've noticed an increase in depression, increase in anxiety, a decrease in frustration tolerance for a lot of people in the community. Some of the barriers that I've seen, which in my thought, I feel like it's very interesting because we're in a time where we have a lot more resources than we've ever had in times before. However, you kind of get to see the nuances of having technology. It's great and amazing, but at the same time, it's still a barrier for a lot of people. So I've had issues with people getting access to homeless shelters and COVID and getting COVID tested. So a simple thing of like, oh yeah, I need somewhere to stay. Okay, well, you can't go into the shelter unless you get a COVID test. Okay, in order to get a COVID test, you have to find a place that has COVID testing. You try to call the place, you can't call, you have to do it online in order to schedule your COVID test. Some of the people I work with don't have online. The libraries aren't open. There's access to those resources. So people do come to the station. I've helped people, make appointments, help make phone calls for people who don't have phone or internet access. Simple things like that. And then you have to wait 24 hours. So where are you going to stay for those 24 hours until you can get into that shelter? So that's a example of barriers. Having phone or internet access. I think a lot of us take that for granted, but there are a lot of people who can't pay their cell phone bill, or who don't have internet access, or who don't have printers. I don't even have a printer. I'm lucky I'm able to, if I need to, print something at work. And those are some of the things you need for telehealth. So there are people who are trying to sign up for telehealth, and some people who have a computer can, e-sign stuff. But if you don't, you need to have a printed copy and to mail it in and wait for that and can go through all those processes. I actually at one point sort of tried to cut out the middleman for that. I got the papers, brought them over to somebody's house, put them in a self-addressed envelope, and so they could fill it out and send it right in, because by the time they got it in the mail, filled it out, got a stamp, did all of that, you're talking, a couple weeks. I've also seen that there's been a lack of social and community supports in general out there for people, and wait times for providers have increased, and there's not enough providers to be providing the services that people need. So waiting to get a therapist can take an extended period of time. And what I've been noticing a little bit more recently is, and I think it's going to happen, I know we're going to talk a little about recovery, is that the burnout for service providers in general, and their ability to kind of having less opportunities to take care of themselves. People can't take vacations, they can't take breaks, they're kind of overworked. And so they're kind of, I think that's going to be a bigger thing in the recovery period is the people who have been out there 24/7. I think that's going to be more difficult as during the recovery period. And lastly, I just wanted to add too that they're like when I'm out there with people, the good thing I think about my role is that I'm able to be there like in the moment. Like I haven't worked from home. I've done phone call stuff, but I'm not doing any telehealth stuff with individuals. And I think just sometimes having people there is important. So we'll have a conversation with somebody outside and we'll stand 6 feet apart. But I think that's really helpful for people to have somebody who's right there and who can help them in the moment and be tangibly giving them paper, giving them information and resources. It's kind of a small thing, but I think it's a big thing overall. And when I'm with people, I try to see what we can do to try to get them to avoid an emergency room, because that can cause more anxiety and more distress because they're worried if they're going to catch COVID in an emergency room. So try to de-escalate them on scene and refer them accordingly to whatever level of care they might need. I try to kind of do personalized like recommendations and referrals. So I'll get their insurance information and I will search all the websites and try to look myself to how can I find them, who's closest, who will accept their insurance, who's taking new patients, kind of take out the middleman for them and try to figure that out. I work with various agencies. My agency, Eliot, their emergency service team, Riverside, Horizon House. I work with Eliot Path team, which is our homeless outreach team. Eliot's tenancy preservation program. So people who are at risk of losing their housing can help them through the courts to maintain their housing. BHCP, which is a community like through case management through your insurance company, Mystic Valley Elder Services, DMH, DDS, the Food Pantry, Learning to Cope, AA, NA, Al-Anon, and the list kind of goes on, and try to see what I can find in the community that can support people like where they are and for what they need. So that's a little bit about what I do and what I've seen.
Thank you so much. That's a really helpful overview. And it's a reminder about the ways in which there are all these different intersections. And so just for people who are struggling and are feeling challenged, starting somewhere, right? And that person, if they're certainly for me, I've seen that to be the case, right? In my 1 year in this role, many people have come to our office. For colleagues who have been in the State House for years and decades, they've said they've never seen the level of constituent need that they've seen in the last year. And obviously, I'm not trained in the ways that you all are to identify specific individual plans for them, but just making connections can make such a difference. And so, if nothing else, encouraging people watching, whether for themselves or for someone they care about, to tell them to pick up a phone or walk down to the police department or check in on an online, to MassSupport.org to just start, and from there, hopefully you can find someone who can serve as a resource to get you to the right place. One thing, as we now turn to sort of the second part of the discussion, and I think we've already laid some seeds here, and this part may be a little shorter than the first, is just sort of what people can be thinking about in the recovery phase. And this can just sort of be, an open invitation for anyone to share some thoughts or ideas. We did get some questions in advance from constituents, including, how could I look to find the right therapist for me? And how do we help people who may be uninsured or underinsured with being able to access mental health services and supports? So if you have thoughts on those questions or other thoughts, one thing that you mentioned is the snowball effect. So people have been holding on to things for a long time, and that may lead to like lower tolerance for frustration and sort of more eruptive behavior. I may have occasionally screamed into my own pillow, in a moment of weakness or strength, as it may be. Maybe that's a way to be resilient. But I do wonder about the recovery phase. So for folks who have suffered loss of life or significant physical debilitation among, people they care about, for people who have lost jobs, who had true, intensive trauma or acute, stress or mental health problems, there obviously needs to be in place resources for them to access. I appreciate also your point about you and the mental health workers and our public health people who have been seeing death day after day in a hospital setting, for example, and what does that do to a person? In fact, I filed a bill this session that would create a commission on post-traumatic stress disorder with attention and attuned really to COVID. And so thinking about how we're going to support people who have been supporting us throughout this process. So there's that. There also are, for people, who maybe haven't had a specific event or a particularized trauma, but nonetheless are grappling with grief and loss. Is there going to be a moment in the recovery where you suddenly have a realization of everything that you've been holding in? Because in some ways, maybe we're sort of in a survival mode, but once we have a moment to breathe, we're vaccinated, and we can maybe start resuming some of the behaviors or activities that were once unsafe. Will we maybe have that moment then to reflect and realize, gosh, I actually need some supports right now. I'm not equipped to actually process everything that I just dealt with for 13 months. So those are some thoughts that come to my mind, and I just will open it up to anybody who'd like to weigh on these questions or any others.
I'll chime in on regards to finding a therapist. I know one good hack, if you do have health insurance, is always just calling the number on the back of the card, because even if you don't know what you're asking for, the person on the other end will help you navigate something that they pay for that is right up your alley. So that's a good hack for that. And then finding therapists is almost like finding a good pair of shoes. It's like you have to try it on. Not everyone is going to be the best fit, and don't think that someone's going to take it personally if it doesn't work out with that one person. I know that therapists in general, usually if you're the clients, you want to give them about 3 sessions to see if it's working out with you. That's just a guesstimate. It doesn't have to be exactly 3, but try to give them a chance. And if it's not working out, on to the next one, because it's really there to help you find services, not to make the therapist feel better. So don't feel bad at all, and just keep trying. If that first pair of shoes didn't fit, you wouldn't go your whole life without wearing shoes. Mental health is very important, so keep trying out there.
Thanks, Christina.
I can also say too that I know there's a link that's on the last page that's going to be put up, that Wakefield has like a bunch of resources on the town website. And one of them is Interface, which is they work with William James College, and you can call them, give them your insurance information, tell them what you're looking for, the reason why you're seeking services, and they can help find a provider who's taking patients, who accepts your insurance and kind of manages like the issues that are going on. So I sometimes use that. I like the back of the card because that's an easy reference as well. And
say
then
that one again.
I would say look in the back of your insurance card. I like that because that's always really good as well.
Yeah.
And the last thing that I'd like to do is psychologytoday.com is very good, because it gives like a picture of the person, so you can, in a little bio of them, and tells you what they do. So that can sometimes be helpful as well.
Great. Any other thoughts just about what's next for us? I really think you're right, Sarah, when you say that school reentry is the beginning. It's sort of, we're having new beginnings, and we're going to continue to have them. We don't quite know, and I also heard a really good conversation a few months ago, I think on maybe NPR when I was driving, that sort of said recovery will look different for every person, because we all have different risk tolerances. We have different compositional and environmental needs. And so we're going to have to hopefully be kind to ourselves and to each other as we work to navigate sort of whatever this reopening and new normal is going to look like. But I think you're right. It's a beginning, and certainly we haven't flipped a switch insofar as the things that we're carrying with us, we still have, and now we're just bringing them into a different, environment.
I think, and go ahead, Courtney.
I was just going to say, to your point, I don't think we're really good at acute compassion. So when things happen, everybody is compassionate. We're here for it. We're there. But most of you all know long-term empathy is hard to find, right? So this idea long-term. So thinking about people are going to be experiencing the effects of this for years to come. We don't even know what is going to be the magnitude of it. And so how do we begin to have long-term empathy versus just telling people to push through? And I think another thing is, how do we begin to not say, get people, because the other thing is emotions can get heightened by expectations. If people expect that they're about to return to normal, then they're going to be upset and anxious, and they're going to be fighting because it's not going back that. And so when we think about reconstituting, sometimes things have to fall apart instead of to fall together, right? And so one of the things that we're really going to have to begin to think about is, how are we coming to a place that we're allowing ourselves the opportunity to think about the next normal and acknowledge that we're going to go from next to next to next. And that it's okay for that. And that it's okay for it to be disorienting. And that's a part of the change process. But I think that's the piece that we're going to have to acknowledge. And even what can be in the midst of ongoing change, what can be those through threads for schools and for kids and for families that remain the same? So regardless of what changes, what's going to be our ritual routine that stays consistent, right? That can continue to give us hope. And so thinking about what are going to be our through threads. Is it at the end of the day, my family, we sit around the table and we talk about what went well today? What are we what are we excited about, right? And just shifting that focus. Is the through thread going to be every day, I know we're going to recite these affirmations, or I know someone's going to check on me at this time and at this day. And I think that's going to be important. Sarah?
Yeah, thank you. You and I were very much on like the same thread, because I agree. I think we're going to have to really monitor the psychological, educational, financial implications of this pandemic. Well, definitely over the next decade, if not well into the adulthood of our youngest learners right now. And I think one of the things that really stands out to me is, I know there's a huge impulse to return to normal, but I think, I think we have to remember that normal wasn't good for everybody before, right? Like the opportunity gap that has only widened with this pandemic has only gotten so much worse, is really something that it's not worth going back to. Right. We, as Courtney said, we really need to move into a new normal where things like mental health and equity are not considered add-ons to educational decisions we're making, to policy decisions we're making, but they're absolutely integrated and on par with those things if we're really going to create some of the change that that we really have been, that some people have really been like literally in the streets fighting for in the last year.
Yeah. That makes sense. Certainly. Let me, any other thoughts? These were great, really helpful. I wanted to make sure that I share with folks watching, how to be in touch with each of us. You've got there my email address and phone number. Again, Christina's slides included that email address and also the hotline number. For BRYT, I've linked to their landing page and also Sarah and Courtney's email addresses. I'm maybe seeing an extra K, Courtney, in your email address. I apologize, but people can probably find you by virtue of your name. And then for Jennifer, as you mentioned, we've got a landing page with a lot of mental health resources for Wakefield and also the Eliot Community Human Services. And you mentioned some of those I think are beyond just Wakefield, certainly. I recognize a few that you mentioned that Melrose also participates in, for example. Yeah. Oh, you're muted.
My contact information can be found under the Wakefield mental health page. So mine, the recovery coaches for our town can all be found on there as well. So that's kind of a good place to look if you're looking for that. And anybody can reach out to me at any time and I will get back to you as soon as I can and point you in the right direction or find the resource that you're looking for.
Great. Well, I do want to thank all four of you so much for joining me tonight and sharing this information and your thoughts. I really feel like this will be a helpful resource for people who are watching when this is broadcast. I'll certainly be sharing it on my social media platforms, and you're welcome to do so as well. And the slide deck we can make available to anybody who's watching if they'd like to reach out. I found it personally helpful just to hear some affirmations. I think one thing that was mentioned is the importance of validation. So for you watching at home or, listening in now, whether or not the events of the last 13 months have been acute and particular to you, which, for so many people that has been the case, or whether it has sort of been a slow burn, I think we all validate that this has had a mental health impact on everyone. And so there are sources of information, there are resources and programs out there for you. As a state legislature, I'd love to hear from anyone at any time about policy that can be provided through law and regulation to support some of these programs and resources as well. The Safe and Supportive Schools Commission, where BRYT has been heavily involved, the comments you made about putting mental health and embedding it within everything we do for students, and thinking about that as critical is very much resonates. And that's something that has been, many people have been talking about, but I think this gives us an opportunity to really reflect on that and hopefully be informed, and to your point, move into a new normal. So there is help out there. There are resources that exist, and you don't have to find them alone. You can start, by picking up the phone or logging in or checking in at walking over to a local agency, and someone will be there to help make some connections for you. So do be well. Thank you again for your time tonight. And I look forward to continuing to work with you on this important issue in the months to come.